So today's webinar, we're introducing the nuts and bolts of systematic review, how to conduct systematic review in a scientific manner. And those who have been involved, and I know some of you have been involved with systematic review, there's a lot involved in doing it successfully and doing it well, and more so if you're trying to publish it in an impactful journal in PubMed. I mean, doing systematic review is one thing, but be able to publish in PubMed journal is whole another story. So you're not going to learn everything today, okay? But it will be a great jump start. You probably have to take entire semester worth of course to really understand. But I think what you're going to hear today, it's going to really get you started in a very, very meaningful way. And I'm really grateful that Ms. Mei-Lin Lei, she will be guiding us through this process today. And Ms. Lei is internationally known in this arena. We grabbed all the way from Manitoba, Canada, right? University of Manitoba. So she very kindly, graciously agreed to spend some time with us today. She's an information specialist and a health science librarian at the University of Manitoba in Canada. Over the past 10 years, she has been involved with numerous systematic reviews, rapid and scoping reviews. Her work has been published in prestigious journals like Cochrane Database, JAMA, and Cancer, among others. She does some teaching as well. So in addition to teaching, she has developed multi-part instructional videos on systematic reviews that are available on YouTube. You can follow up with that. So let's give Ms. Lei a warm Southern welcome. Yes?
Thank you for the...
And with that, I'll turn it over to Ms. Mei-Lin Lei. If I'm saying it correctly now, I'm pretty confident, so Mei-Lin. So thank you again, Mei-Lin, for being with us. We want to keep it really informal. I don't know what the folks on the online are going to do. We have no control. But folks here, you can kind of move around, get food, get drink if you need to step out. So we'll keep it very informal. So we're calling it webinar, but it's kind of a workshop. So I don't know about the technology, but feel free to ask questions. And at the end, we'll see if the online folks also have some questions. Okay? Thank you so much. Appreciate it.
Okay, hi everybody. I'm just going to share my screen so you can hopefully see my slides. Okay, there we go. There we go. Okay, so I just wanted to say that I put it in the online chat, but the link for the slides is listed. There's a URL there, and I've also put a QR code. You can scan it with your phone just to access the slides for today. And as we go, I can kind of see. I can't see the chat too much. Hold on, maybe I can make this a bit bigger. So I would say if you have questions, the best thing to do is perhaps to, oops, hold on. I think just to either raise your hand, and then I should be able to see when somebody raises their hand, or you can just feel free to kind of interrupt me, and we'll also have time for questions at the end. So, and if you have questions and I don't see them and you want me to just stop, just kind of talk over me, I'm happy to address questions as we go. So today is an introduction to systematic reviews. And really the outline for the class today is kind of introduction and objectives. So what do I hope to kind of accomplish today in the workshop? And then spending some time on really defining what is a systematic review. And that also kind of includes distinguishing it from narrative reviews or other types of reviews. So what kind of sets a systematic review apart? And then we will dive into the actual steps of a systematic review. What do you need to do to kind of complete them? And then spending a larger bulk of time kind of talking through the searching part. So the data collection, how do you do that? And really want to emphasize that what I am going to cover kind of in the next hour and a half, hour and 45 minutes is really just an overview. So each aspect here, you could spend a lot more time on, but really what I hope to kind of accomplish is to make you at least familiar with the different steps and how you might do things. So even if you're not an expert, at least you know then, okay, well, this is something I need to think about. This is where I need to go find more information. And throughout this slide or throughout the presentation, I have a lot of links to really helpful resources where you can go in and then do that deeper dive. So in no way is this going to teach you kind of the whole process of doing one and searching, but it's really kind of that introduction. And so you get an idea, especially of how to do kind of a higher quality systematic review, what I call a capital S versus a little s systematic review. Okay, so introduction and objectives. So thank you for the warm welcome. If any of you are wondering where Manitoba is, we are directly above North Dakota, and we're actually a pretty big, well, geographically big province. We're not that big population-wise, about 1 million people. But I work at the University of Manitoba as a health sciences librarian, and have worked in kind of a variety of different health sciences libraries for the past, 10 to, I guess, 15 years, 10 in my last position here. And a big part of my job is to help students and faculty with what I kind of, the broader umbrella term is evidence synthesis project. So that includes systematic reviews, scoping reviews, rapid reviews, umbrella reviews, all these different kinds of reviews. And as my own kind of research, one of my areas of research is I'm also looking, or have been looking a lot at kind of the rise of systematic reviews outside of the health sciences. So kind of systematic reviews and all other review types is just a big part of my kind of day-to-day life. Okay, so objectives. Hopefully what you kind of walk away at the end of the session today knowing how to do is being able to explain what the differences are between a systematic review and a narrative review. We'll also talk a little bit about scoping reviews. To describe the steps involved in writing a protocol. So protocol is the outline of your systematic review project that you kind of do before you actually start work on the systematic review and often want to publish or register it. Then actually outline the steps needed to complete a systematic review and to perform some kind of basic and advanced searches. We're going to concentrate mainly in one database, but really that you could use a lot of those skills or that knowledge and apply it to different databases. Oh, and one more. I forgot, access resources for additional information. So this one is key. I've put them throughout the slides, and then I have really highlighted the ones that I think are the highest quality ones at the end for where you can go and really learn a lot more about how to do a review. There are a lot of great resources online, and just knowing kind of which are the good ones, which are the, the best ones to access. Okay, but before we get started, because I'm so far away from you guys and I kind of wanted to get a sense of what people were hoping to kind of get out of the session today to make sure that I can address it. So if you just have a second, I don't know if you guys use Menti. We use it here a lot at the U of M, but you can just go to www.menti.com and then put in this code right here, or you can use the QR code. And I'm just going to pull it up on the screen here. And the code will be here as well, too. Okay, I see a few of you are already in there. And really, just a very, very basic kind of question. So you can just put in whatever you want is, what do you most want to learn during this session? So I'll just give people a second to enter something in there. Okay, rigor steps, the best practices, data extraction. Okay, we'll talk a little bit about data extraction, but it's not a big focus, but I'll definitely point you to some helpful resources. Yes, we're gonna do some tips for sure. Optimizing the search strategy, knowing when it's enough. Yep. Search strategies, managing articles. Okay, data extraction. Okay, so data extraction is important. Okay, I'll just wait a second more. Just general, want to learn a little bit more about reviews. Okay, got it. So definitely people are interested in data extraction. So I'll make sure then to find out how to do them, the bias. Oh, backwards and forward searching. Okay, if this one, make sure if I don't address it in the presentation, just bring this up again, the backward and forward searching. Yeah, because I'm happy to address that. Okay, So, and then what I'm going to do is I'm going to leave this one up. So if at any time during the presentation you have a question and maybe you don't want to ask it in front of the group, you can put in your question here. It's completely anonymous, and I'll come back at the end of the presentation just to see if there's anything in here that we want to address. Okay. So what is a systematic review? So really, systematic reviews are tied kind of very tightly or closely to evidence-based practice, or sometimes called evidence-based decision-making. So I put in here a quote from Dr. David Sackett, who was one of the kind of founders of this school of thought, is not the right way, but it's just a whole different way of practicing healthcare. And it originated up here in Canada in kind of the late 1990s, early 2000s. And what it did is it changed the way that healthcare practitioners were supposed to kind of practice. So moving away from making healthcare decisions, based on the, well, that's the way I've always done it, I'm going to keep on doing it, but really changing it to how do we make healthcare decisions, and what evidence kind of are we making those decisions on? And so it's really this integration when you're making a decision on using the best available evidence and clinical experience and what the patient values or what their preferences are. So where kind of systematic reviews come into this is best available evidence. And we'll see that in just a second when we get to kind of two slides. So this is just a nice little kind of Venn diagram, but evidence-based decision-making, again, it started as evidence-based medicine, but has really expanded to all areas of healthcare. So I tend to use evidence-based decision-making, but is when you're making that decision, how are you coming to your conclusion, to your recommendation? And you really want to be taking these three different components into consideration. So the best available evidence is really tied to the evidence pyramid. And this is not the, I guess I could have, it looks a little blurry to me, maybe it doesn't look to you. And it's a big, we talk about the evidence pyramid a lot when I'm teaching med students or other kind of health sciences students. And really, the evidence pyramid is a visual indicator on different types of evidence or information that can be used. So what you can see, just in case the evidence pyramid isn't kind of taught a lot, I'm not sure. So at the bottom of the pyramid, you have a lot of people who have their expert opinion. You have a lot of background information. So you have let me go back here. You have a lot of that. And then basically as you move up the pyramid, you will have less of that specific type of evidence, partly because it kind of can take a lot more work to do. So it's very easy for me to give an expert opinion. It is a little bit more complicated for me to say run a RCT. And the other difference is that you can see here the difference between unfiltered information, which is often kind of thought of as the primary literature, versus filtered information. So filtered information is studies or topics where they look at a whole bunch of the primary literature and kind of add almost like another set of eyes, another set of appraisal, and they combine a lot of these primary studies or unfiltered information to be able to provide kind of a broader perspective. So there are a lot of different versions of systematic review, or pardon me, of evidence pyramids out there. Sometimes there will be different things at the top, like systems. Sometimes you'll see our meta-analyses in here as well. This tends to be the main one people use, but you can see systematic reviews, they are kind of harder, they're harder to do, they take more time, and there are fewer of them. It does not mean that they are they're better than, say, RCTs. It's just a representation of, in terms of the quality or level of evidence, where they fall. And the other thing to remember too is that, as I'm sure you know, since you're all involved kind of in patient care and healthcare and that kind of thing, is that you don't change practice or make kind of new decisions based on a single RCT, right? You need to have something like a systematic review or a guideline, which looks at a lot of information before you're making any kinds of recommendations. And the last thing I'll say about the evidence pyramid is that really what you're trying to do as you move up the pyramid is you're trying to reduce bias. And there's no way to get rid of bias kind of altogether, but you're trying to get rid of as much bias as possible. And that's really the ultimate aim of the systematic review, is making recommendations with as little bias as possible or knowledge about those biases. And if you click on, I won't go into it, the catalog of biases here, you will see all of the many different types of biases that can kind of be present in different studies, whether that is reporting bias or selection bias or sampling bias. There's a lot of different kinds, and how do you kind of correct for them or control for them when you're conducting studies? Okay, so the purpose of a systematic review is you want to find all available evidence. So that's key. It's not just the evidence from the last 5 years that you want to look at. It's not just the evidence from one particular state or one particular country. You want to find everything that's out there, whether it's published in the high quality journals or the lower impact journals. And from all of that, what you're trying to do is you're trying to confirm whether current practices are effective. You want to identify potential variations in how things are being done, whether that's how a drug is being like different dosing or administration schedules. You want to identify any new practices that are out there. And from all of that, it can help identify and inform areas for future research. And as well as that is make recommendations. I can't remember if I have, I do for there. Producing statements to guide decision-making. So systematic reviews are often used to make guidelines about how care should be delivered. And also in a systematic review, you want to be investigating if there is conflicting results or evidence and try and figure out why. Like, why is one particular study saying, okay, well, this works really well, but then another study is saying, no, that doesn't work well. So trying to figure out why there is that conflict. And so this is just a quote on a systematic review, kind of, again, repetitive, but they are designed to collect all empirical evidence. It must fit pre-specified eligibility criteria, and it wants to answer a very specific research question. We'll come back to the research question later on, and it uses explicit and systematic methods in order to provide more reliable findings from which conclusions can be drawn. Okay, so some key attributes. 1, it's systematic. 2, it's incredibly comprehensive. So there is steps that need to be followed. All of those steps are designed to be as broad as possible, and it needs to be transparent. So this is really critical because I see this as a problem in a lot of reviews. So I'm also a peer reviewer. Excuse me. I'm also a peer reviewer of systematic reviews. And what I see is that a lot of published systematic reviews, they don't publish all their searches, which means they aren't transparent. So you can't replicate them. So a systematic review, it should be designed that if I do one a few months from now, you could go and recreate it exactly. Okay, so that is systematic reviews. That's what we are primarily going to focus on today. But I do want to just highlight kind of how scoping reviews and narrative reviews also fit into the broader evidence synthesis kind of umbrella. So scoping reviews, if any of you have been involved in them, they have a different purpose. What they are designed to do is identify different types of evidence in a particular area. They help kind of clarify if there are different definitions or new concepts in the literature. You're really trying to map what is out there, what is happening in a particular discipline. Their questions, examining how research is conducted, their questions tend to be much broader. So you're not asking and answering a really tightly defined clinical question. You have these broad questions. You just kind of want to know what's going on in this area. And yeah, identifying key characteristics or factors related to a concept. So it's not necessarily a yes, no kind of question. It's what's happening in a field. And often what can happen is you will do a scoping review, and then it will help identify what, what you might want to do a systematic review on afterwards. Okay, yes, sorry, I've got so many things for a scoping review purpose, and to identify and analyze gaps. So really seeing, again, what's being done in a field, where might we want to do future work, future analysis. And something that many of us might be even more familiar with is a narrative or a literature review. And these they still serve an important purpose. And I think sometimes they get a bad rap, but they can still be really helpful. They are an account of what has been written on a specific topic. They can highlight different strengths and weaknesses in an area. What kind of why they get a bad rap is that you, as the writer, the author, pardon me, you get to choose which articles you want to include. So it's selective sampling. So if you're trying to kind of push a particular agenda, it is much easier to do that using a narrative review than, say, a systematic review. They can still, though, discuss controversies. So again, identify what's going on, where are there disagreements in a field. And again, can push towards what else do we want to look at in this area and identify future research. Hold on, I'm just going to pause and have some more water. Okay, we'll see how I do. Okay, so I put this in here. I'm not going to go through step by step. I wanted you to have it as a resource. So in case you were wondering kind of what are the differences, you could see them here in terms of what the purpose is, how the research question works, what the search looks like, how articles are even selected for being included or excluded, what kind of appraisal is done of those included studies, and as well as what kind of synthesis or analysis happens, where the bias comes in, and outcomes of goals. So again, each one of these has a particular purpose that it serves in the literature. So one kind of isn't better than the other. I think systematic reviews, people think they're, people love to publish a systematic review, but narrative reviews still have a lot of value. And I work a lot in areas now. I work a lot in different areas of rehabilitation sciences and with nurses, and scoping reviews are increasingly popular in those areas. So each one of these different types of reviews has a purpose and has a value. Okay, oh, and I just threw in 3 examples just to show you kind of the differences in even just the title and the objective of 3 different articles that all have to do with smokeless tobacco and smoking cessation. So here you can see it says efficacy of smokeless tobacco for smoking cessation, a systematic review and meta-analysis. For this one, it is a scoping review of existing evaluations of smokeless tobacco control policies, what is known about countries covered. So that's really you can see this one is trying to answer a specific question. How effective are these different smoking cessation strategies that involve smokeless tobacco? This one is what's happening? Where are the different policies? What we want to kind of know how do different countries handle this? And then the last one is a narrative review. So just talking about residential treatment for tobacco use disorder. So again, all have value, different purpose, different design, and they all can be, you can see they all can be published. So you can kind of publish any of those. Okay, so some things to remember. So again, you've probably seen I tend to work a lot in the health sciences. I have done some social sciences reviews in psychology, But because systematic reviews really originated in the health sciences, that is where the methodological guidance is the strongest, where it's very clear what you should do, how you should do it, what the steps are involved in doing it. So you can see I've listed here two of the big ones, the Cochrane Handbook for Systematic Reviews of Interventions, as well as the JBI Reviewer's Manual for Systematic Reviews. JBI is based out of Australia, but it's one of the big organizations involved in knowledge or evidence synthesis, and then some scoping review resources. So I just want to, I think I have it next. Okay, yeah. So I want to very clearly kind of differentiate between methodology and guidance on how to do it and reporting guidelines, because people often kind of confuse them. So these resources will tell you how to do a systematic review, step by step. They're very comprehensive. They will guide you through the process. What you need to help you when you're writing your article and designing your study and figuring out what you want to report on are the PRISMA reporting guidelines. So sometimes, again, I see that in published reviews where people say they followed PRISMA guidelines on how to conduct their systematic review. That is incorrect. PRISMA tells you what to report on, what to put into your article, but they don't tell you how to do a systematic review. So I just wanted to click over just so you can see. So PRISMA is, it comes with kind of like a whole checklist. So even though it doesn't tell you the methodology of how to do them, they can be really helpful to read in their entirety to kind of guide you. So if you if you look at the checklist, let me open it up here. You can see it will include all the things that you want to include when you're publishing and writing up your systematic review. So step by step, this is what you need to include in your methods. This is what you need to include in your results section. So it's just, again, you need to include all these things. You need to check them off. And when you write up your paper, only if you have checked off these things can you say that you used PRISMA reporting guidelines for your study. PRISMA also includes what are called PRISMA extensions. So the main PRISMA part was for systematic reviews, but there's all these different extensions related to if you're doing, say, a living systematic review, if you're writing a protocol, if you're doing a scoping review, even when you're working on the search for the systematic review, they have checklists and guidelines on how to do it that are listed here that are really worthwhile to look at. And probably what many of you are most familiar with is the PRISMA flow diagram, which you will see in almost every systematic review. Let me see if I can get it up here. I think I have some screenshots later on if it doesn't load, but it looks like this. So it basically shows you the process that the researchers have followed from when they started their search down to their final, how many studies were included. So again, this is designed to reduce bias by showing exactly where they searched, exactly why you excluded some studies, exactly why you included other studies, just kind of step by step. So those are all kind of listed out for you to go and take a closer look at depending on what kind of project you're going to be embarking on. Okay, so I'm just going to pause, have a sip of water. Does anybody have any questions before I dive into the steps for a systematic review? Nope. Okay, we're all clear. Okay, so once you've decided systematic review is the right kind of review type for you, what are the steps that you need to follow in order to hopefully do it properly and get it published at the end? So I made this kind of handy little image, I guess, that kind of shows the whole process. But I'm going to go through and talk about each one of these. But I find this is kind of helpful just that you can kind of see how each part obviously leads to the other. But that it is, don't be, I have a lot of students who come in and they want to do a systematic review kind of in 3 months, or they've got their research block during their rotations, and so they want to do a systematic review. They can take a really long time to do, and they do require a team. So you want to make sure that you have all the resources kind of in place to do it before you kind of get started. So before you actually even do anything, before you start your review, you really want to make sure that there is actually the need for you to do a systematic review. And so because systematic reviews take so long to do, and because they are about being very transparent, it is kind of the standard that you publish or you register your protocol prior to beginning a review. So again, one of the other reasons is like if it takes you, say, 3 years, maybe let's say it takes you 2 years. Let's say it takes you 2 years to do your systematic review. You don't want someone to have done a systematic review on the same topic and they publish before you do. So what you do is you register your protocol to say we're going to do this. You put it in a public online space, and it kind of is like you're dibsing that topic to say, this is my topic, nobody else do this. We've got people working on it. It's just you don't want to duplicate years of effort from multiple researchers if it's not needed. So the two kind of main places where you can find protocols to make sure that no one else is currently working on a systematic review on your topic. One of them is Prospero. So you can search very easily through Prospero on different topics. So let's just say I want to look at, well, let me just put in, I'm going to put in something I've been working on, which is deprescription. I could go in and see all of the systematic reviews currently underway on the topic of deprescription. It will also show me which ones are Cochrane reviews. It looks like none of these actually are, but you can see them, and then you could go in and click on each of them to kind of see the project themselves and see, you know, is their objective, is their question the same as mine? Do I really want to do this? So highly recommend making sure nobody else is doing a review before you start your review. The other place where people register is called Open Science Framework. Again, you can register your protocol very easily there. It's very easy to search. Both of these, actually, you know, I'm not sure about Prospero. Open Science Framework is scraped by Google Scholar, so your results show up in Google Scholar as well. But then you also want to make sure that there is you want to make sure there isn't a systematic review already on your topic that has been published pretty recently. And you also want to make sure that there is enough primary literature or primary evidence in order to do the systematic review. So I've had some teams where I've worked on it, I've done the full search for them, and then, you know, at the end, they just don't have they don't have enough primary studies in order to answer their question. So in some ways that is helpful in its own way because it says we need more primary research, but it can often also be a little bit harder to publish those studies. So it's something to keep in mind. It is not uncommon for researchers to know all of the studies that they're going to include in their systematic review before they even start. But really the systematic review is just making sure you found everything. So you can also search in PubMed or Medline on your topic and narrow it down to just systematic reviews to make sure that there are no other reviews on your topic. So I'm just going to put in deprescription again. And then PubMed allows, I've already got the filter applied. PubMed allows you very easily to filter to systematic reviews. And you could, I would probably have a more specific topic than just deprescription, but you could quickly skim through here and make sure that nobody has published a review on your topic as well. Okay, so if you've gone through, you've decided, yes, we need one, then what you need to spend time doing is developing your question. So your research question, it is the whole basis for your project. And certain kinds of questions are best answered by different types of reviews. So systematic reviews are not the best review type for every kind of question. So there are kind of tools out there to help guide you based on your topic. So I find this one really helpful. It's called Which Review is Right for You. If you click on it, Maybe you're already working on a project, that's a possibility, or you're thinking about starting one, but even just going through and seeing what kind of review should you do. So I'm not going to do the whole process, but you can see, you can pick, okay, whether you have qualitative or quantitative data, and then you kind of just go through. It's very broad. It's not your specific topic at this point, but it's how you want the study to be conducted, how many people you have on your team, how much time you have, and it will make a suggestion to you about what kind of review type you should do. Okay, so once you have your question, once you have your review type, you really want to then kind of help structure your research question. So asking an answerable question is very important for a systematic review. What happens a lot is people have like a general area of interest. They want to know more about a topic, but they're not trying to answer a specific question. And so there exists different kind of frameworks to help you structure your question, just to kind of clarify your own thinking. So probably many of you are familiar with PICO. There's a whole slew of frameworks based on what your question type is. PCC is a very common one for qualitative research. SPICE is another one, and there is a whole website here that guides you based on different review types and figuring out what you actually want to investigate. So PICO isn't always the best, it's the most well-known, but PICO really is best designed if you have clinical questions. So if you have anything that isn't clinical, you might want to consider a different kind of framework to help you structure your topic. But I am going to use PICO for our kind of sample topic today, just because it is the one that is most familiar to people. So P stands for your patient or your population. E is your intervention. So what new thing is being introduced into your environment? Is it a new drug? Is it a new way of kind of treating a disease? Is it a new strategy, a new program? What's being introduced into the system? C is for comparison. What is it being compared against? Sometimes that comparison is placebo or standard treatment, but sometimes it's, very clearly, we want to compare drug A or drug B, treatment A or treatment B. So then you would have a comparison. And then your outcome. So you want to be really clear with your outcome. You don't want to have kind of very vague, like we're interested in improved health. Well, how? What specifically? Do you want to see decreased days in hospital? Do you want to see decreased visits to a primary care physician? There's a lot of different measurements or tools that are used. So what is your specific outcome that you are trying to find out more about? So what I did is I came up with a kind of clinical scenario to then pull from that into a specific PICO question. So you don't have to kind of read all of that, but this is often what happens is people have kind of a lot of different, a big topic that they're interested in, and how do you take all of this and turn it into an answerable research question? So from all of this, what I would do is I would read through it. It's about a pediatric oncologist. And then what we're going to do is focus on the key concepts. So in this question, the key concepts are going to be children who have cancer, and some of their kind of side effects of that are nausea and vomiting, chronic pain, and anxiety. And really what we're interested in looking at is medical cannabis to potentially help these symptoms. So from all of this information, we are drilling down on just those 4 things. So otherwise, if people try and search this, it's like, how do you take that question and then search it in the literature? It can be just really hard to do. So that's why you really want to narrow your focus. And so if we were to turn that into a PICO, it would be children, and we would want to have a clear age definition for what group we're interested in. So children with cancer. Our intervention that we're interested in is medical cannabis, medical marijuana. we are comparing it to either standard treatment or placebo. And what we're looking for is a reduction in nausea and vomiting, reduction in pain, and decreased anxiety. So from that clinical scenario, we have kind of drilled down to just these key concepts. And then from that, we can turn it into a PICO question. So if you've ever seen a PICO question, they have a very standard kind of format, but basically it's like this. In children with cancer, I realize there's a mistake there. In children with cancer, is medical cannabis effective at reducing nausea and vomiting, reducing pain, and decreasing anxiety? So we've gone from this to this. And that is what you're trying to do, is drill down on your very specific question that you are trying to answer. Okay, so you've got your question. Now you need to assemble your team. So systematic review teams, minimum 2. I don't think I've ever worked on a systematic review that had only 2, but you have to have minimum 2. But typically the teams are much bigger because you have people who are contributing different parts to the review. So you have people who are experts in the actual kind of subject being studied. Often you may have people who are experts at doing systematic reviews, so they're methodologists. Then you would bring on different experts, so librarians or statisticians. You may have methods experts, and then you may have people who are experts, say, in meta-analysis. All of those are often the statisticians. So all of those people come together and they each contribute differently and different things to the review, but it's not uncommon to see very long author lists when you are looking at a published systematic review. Okay, you've got your question, you've got your team. Now what you need to do is come together and write your protocol. So your protocol is the outline for the whole project, and you really want to make sure that you spend enough time on developing it. It will save you so much time if you do a good job with your protocol right from the get-go. And so I think I mentioned it already. Systematic reviews are all about being extremely transparent. And so that is why the protocol is there. So once you kind of publish or register your protocol, you can't really change too much of it. There's some changes that can be made. People might drop out of the project. Maybe your search method might change a little bit, but you typically are not changing the question, your inclusion or exclusion criteria, or your outcomes studied, because what it's trying to get rid of is that you would do the systematic review, but then based on the literature, you suddenly find that it's not telling you what you wanted it to tell you about how effective, say, cannabis is at treating cancer pain. And so you adjust the study, right, to kind of meet what you wanted the literature to say. So you don't change those things once they have been published or registered. And I would say for the high quality journals, if you don't have a protocol, if you don't have a registered or published protocol, you can't publish your systematic review. They want to see that you have done it properly and that you have registered your protocol ahead of time. I would say the very top tier level systematic reviews publish their protocol. So they don't just register it, they publish it, they go through the peer review process to get it published too. So that is also an option. As I mentioned, you can put your protocol, you can register it in Prospero or Open Science Framework or JBI, or you could try to get it published too. There are specific journals that publish protocols. And what I say is when I'm trying to guide people on how to write a protocol, often the best thing to do is to look at other people's protocols to kind of get an idea of what they include. There is a lot of variation in them. There's just differences in terms of quality, but there is the PRISMA-P kind of reporting guideline will show you what you want to report on when you're doing a protocol. So you can see here, hopefully you can see that. You want to say kind of that it is a protocol. You want to say who are all the people on the team. You want to say if there is any funders for the protocol. What's the objective? How are you going to include or exclude studies? What's your search strategy going to look like? How are you going to manage records? So basically you're outlining your whole project ahead of time. And I did link as well here to a protocol template that you can use. So if you're about to write a protocol and you kind of want to know what to include, there is a whole kind of template that you can use to follow, and then just use that just to make the whole publication process, or pardon me, registration process a little bit easier. This is often as well quite common, having a Gantt chart just to show when you hope to be done certain parts of the project. Okay, so we're going to come back to literature searching, but I just wanted to put it out there very briefly, but we're going to come back to it. So the literature search for a systematic review, that's your data collection. So you want it to, well, I'm very biased, but you want it to be really well done and really exhaustive. And to do that, you need to use a combination of keywords and subject terms, which I'll talk about, but it's really about having a very broad, comprehensive search. You have to be aware of the fact that there are different databases to search for literature, and that each database, just for fun, uses different subject terms, different syntax and how it works. So you have to kind of get familiar with each different database in order to be doing it properly. As you are doing your literature search, you want to be saving everything. Even if you think you'll remember, just save it. You want to document everything. And that's because your final searches have to be replicable and be able to be shared. So you want to really make note of what your final searches are, how many numbers, how many articles you found on from each database. You want to capture it all, because you never know when you might be called upon to use it. I was involved in a project that was trying to update guidelines for a specific condition. Anyways, I did the original searches in 2018. The team kind of forgot about them, and then they came back to me in 2024 because they wanted an update for it. And if I had to start from scratch, it would have been a huge project. But instead, I had everything saved. It was much more streamlined because I had saved everything and had everything documented, because there was no way I was going to remember what a search looked like from 6 or 7 years ago. So that's not normally the case, but still, just document everything. Okay, so once you have all of your, you've done your search in a bunch of different databases, you have a whole bunch of references. So what do you do with those references and to get them into software to do screening? So I linked to 2 different ones here. I'm not sure if you have a subscription to Covidence, which is what we use, but I'm guessing not. It's not super common, but it's a great screening and extraction software. But a similar one is called, I always want to call it Ryan, maybe people call it Rayan, but I'm just going to open it up here so you can see. Oh, I had already logged in, but it's gonna, oh no, here, I logged in over here. Okay, so what you can do is you start a review in this product, and then this is just one of my sample ones. And then you can import all of your references into the project. You can add different team members, and then you can go through and start screening. So let's see if mine will work here. Okay, so you can see this is me screening. So at this point, this is just me reading the title and the abstract to decide whether to include or not include. And you can see all I would do is I would just flip through here on the bottom, include. I would read this a little bit more closely, exclude, include, exclude, right? And just go through. And then what's happening at the same time is you have at minimum another person screening and doing the same process to decide whether to include or exclude. So there's a variety of different software out there to help you with the screening process. You do, I think I have it on the next slide here. Oh yeah. So you have, when you put all your references into a program like Rayan, you do 2 rounds of screening. So the first is you just screen the title and the abstract. So you're doing like a quick read to decide whether to include or exclude. You have to have at least 2. And I put here, if you have conflict, so if one person says include and one person says exclude, the conflicts can be resolved by a third person or the two people coming together to reach consensus. And really, when you're deciding whether to include or exclude, it's based on your protocol and when you've outlined your inclusion and exclusion criteria. So what kind of studies are going to be included and what kind of studies aren't going to be included. So you want to be as clear as possible about this process. And again, this can take a really long time to do to get it right, inclusion and exclusion criteria, but you want to make sure that it's very clearly outlined before you start screening anything. And then once you've done your title and abstract screening, then you will move on to full text screening. And at that point, again, you have to have at least two people. And if you decide to exclude something, you have to say why you have excluded it. So again, this all comes back to transparency. So that if someone, say a researcher in an area is like, well, why didn't you include my article? You could very easily go back into your records and say, okay, well, we excluded because you had the wrong population or something like that. So you want to be very clear about why studies are being left out. And I just thought I'd show you Covidence. So this is a project that I'm working on right now. So this is what kind of the interface looks like. And so what you do is you can see I've imported a whole bunch of different studies. And then all those studies were screened. There were 3 of us on the team. I screened just under 1,500 articles for title and abstract. Of those from those studies, then we went into the full text review of just under 2,000 articles were screened for full text. And if I was to say these 3 that still haven't been screened, I could click that and then go in and look at the articles to decide whether to include or exclude them. And I would need to access the full text of the article. But it's a very straightforward to use program, and Rayan works like that as well. I haven't used this for a few years because I have access to the paid software, but it's just like that as well. And this part is completely blinded. So if you had another person on the team working, you wouldn't be able to see my decisions, or you wouldn't be able to see their decisions, right? Because it's all about keeping things blinded and separate until you've come to your final until you're done screening, and then you unblind it, and that's when you do your kind of deal with conflicts. So yeah, I would say if you're a program that might be doing a lot of reviews, I don't know what a site license for Covidence is, but I use it all the time, but definitely check out Rayan. You can do, I know that people do screen in Excel. I don't know why, if there's great free resources. So I would definitely use one of these for your screening process. And it will also keep track of your numbers for your Prisma flow diagram at the end. Oh, I think I included some screenshots just in case Covidence wasn't working for me. Yeah, okay. Okay, so after you're done your whole screening, that is reflected, as I said, using your Prisma flow diagram. So here you can see in this sample one here, for this particular study, they had just over 4,800 articles. They identified some additional ones through other ways, duplicates, 283. They screened just over 5,000, got rid of 4,500 roughly. And then they reviewed just over 500 for full text. And then they have the reasons why those ones were excluded listed. And then the total number of reviews included in the final project are listed here. And then they've split them into kind of their 2 different categories based on the study type. So again, you can keep track of all these numbers manually, but if you can use a software program that kind of does it for you, it just saves you a lot of time. Okay, so extraction. I know a few people mentioned it at the beginning. So extraction can take a long time, but basically your data extraction is once you have identified all the studies that you want to include, then you actually need to go through and read those studies and pull out the information that you need to begin your analysis and your synthesis. So for data extraction, Covidence, I use Covidence for data extraction because it allows you to build in data extraction tables right into the product. But a free resource is called, I haven't used it myself, but I've heard it highly recommended, is called SRDR Plus. So I only do a little bit of extraction for my own studies. So I'm always cautious about giving people a lot of advice on extraction, but I would definitely explore this resource here. And I'll just show you though, what it looks like to do data extraction. So let me, in this one here, I have 75 studies ready for extraction. So what has happened is my team and I have built a data extraction template. We built it kind of before we even started screening. I'll just click it to show you. And what you can do here is you can indicate what you want to pull out about the study. So these are just the different parts of the study that we were interested in. It's obviously fully customizable based on what you are planning to do for your topic. So you want to build a data extraction table. This is commonly done in Excel as well. And then test it on, I would say, at least 5 studies before you kind of send your whole team off to do data extraction. Because it may seem really straightforward to you, but once you actually start reading the articles and pulling out the data, there can be just a lot of confusion, and you want to make sure that your data extraction table works well before, like pilot it before you kind of roll it out to everybody. And typically you would have 2 people doing data extraction as well, because again, you want to make sure that there is consensus and that nothing's been missed. So yeah. So this is when, if I was to do data extraction, this is what it looks like. And I think this SRDR Plus is similar. Is I click on, let me just click this one, for example. I click on it. Here on the left-hand side is the full text of my article. And then I go through, oh, sorry. Should I do it over on this page? Oh, sorry, these ones have already been completed. But basically what you do is it kind of looks like you just pick the study and then you enter it in side by side. So it's not letting me do it here, but it is very, oh, let me start these. This is what I want, not started. Okay, begin extraction, here we go. Okay, so here's my study, and then you can see we've indicated this is what was in my template, this is what I'm pulling out, and then I can just go through and like toggle and pick my things very cleanly and easily. Just a little bit more, I don't know, elegant than using an Excel spreadsheet, but use whatever tools are available to you to help streamline the process. So once you've extracted all your data, kind of depending on how similar or dissimilar the studies are, you may be able to run a meta-analysis to give you kind of a pooled effect. This is really only possible, again, if the studies are very similar. I'm not going to get into kind of the statistics of it, but if you've ever seen a forest plot, also called a blobogram, that means that that systematic review has done a meta-analysis as well. So I always like to tell this story. I find it really impactful. So this is a systematic review that was done, kind of one of the landmark ones. And so if you've never really looked at a meta-analysis before, maybe you're all super familiar, but if not, each one of these lines represents a single study, a single primary study. You can see here this is the confidence interval. On the left-hand side is the intervention. On the right-hand side is kind of the control. If you looked at all of just the individual studies, it was really difficult to get a picture about how effective this particular intervention was, which means that practice wasn't changing because there was just a lot of conflicting results. But once the studies were pooled and a statistical analysis was done, it was very clear then that the control, or pardon me, the intervention was effective and was working. And it basically it changed practice in what it was corticosteroid treatment for preventing preterm birth, and it changed practice. And as a result of this systematic review, they estimate that it probably saved thousands of lives. And this particular meta-analysis became part of the Cochrane logo. So you can see it reflected here, just to show the value of systematic reviews, because what can happen when many studies are combined, you're able to get kind of better recommendations on what is actually happening. So other things about data extraction is I put in here, this is a sample extraction table for what kind of information you might want to pull out, but really it varies so much and is dependent on what your question is, what you're trying to answer, what you're trying to pull out from the study. And I find the U of Toronto, I'm going to link out to them a bunch of times, have a really great data extraction page that can help. And what you're also potentially doing at the same time when you're extracting data is you're also grading or doing critical appraisal of those studies, because that's also part of systematic review, is you are appraising the methodological kind of rigor of those studies, because if you're only looking at low quality evidence, it kind of impacts how strong of a recommendation you can make. So I am not an extraction expert, but I think by looking at some of these resources here, you should hopefully get a lot of helpful information. And what you may notice is that a lot of my links are to Canadian resources. I think Canada does a great job with systematic review, so I'm linking out to our resources because I think they're really helpful. Okay, and then the final step, oh, you're done. You've done your extraction, you've done your analysis, you've written it up, is then you start writing up the results. So one thing to be aware of is because of the systematic review process and how long it can take, you may need to update your search. So sometimes, for example, I will do a search for a team in say 2023. They're finally ready to publish in 2025. And they need me to run an update just on those last 2 years, just to make sure that no new material has come out in that interim. It's very common for journal editors. I think a lot of journal editors, if you're submitting and the search was run more than a year ago, they're going to ask you to update it. So that comes back to how well did you document everything. And I like to put in a plug. I'm a big fan of using credit to assign contributorship for what everybody did on a team. So if you've never used credit for your studies when you're about to publish, I'm really encouraging people to. It's a NISO standard, but what it does basically is you outline, these are the 14 different rules, and you just say kind of who did what on a project, and it gives people credit for the work that they did. So that's my plug for that. Okay, so the final section is kind of a more in-depth searching the literature. I don't think I can see the chat, but does anyone have any questions? Feel free to unmute and I'll just have a sip of water. Okay, well, I can't see anything, so I'll just keep going. I'll just assume that everything is kind of crystal clear. So what I wanted to spend kind of the remainder of the session on is some tips, some tricks on how to search the literature. This is obviously what I am, the main part that I contribute to a team, so it's what I have the most experience in. And I would say a lot of times it is an area where some systematic reviews lack, is a not super high quality search of the literature. Okay, so systematic review searching. So to do them, you need to have a thorough, objective, and reproducible search of all of these different sources. And really, it is the search which distinguishes your project from traditional narrative reviews, because of how it has been designed to reduce as much to minimize as much bias, potential bias as possible. So that is really what makes it different from other types of reviews or research of that nature. So here are some elements of a high quality search. One, it avoids missing relevant studies. And the way that it does that is they are often designed to be incredibly broad. So that's why you go from, like when we looked at that Prisma flowchart, why you go from say 5,000 results that you looked at and you only included say 50, is you've done a really, what's called a really sensitive search. You've looked kind of for everything, and then you've narrowed it down. You found your relevant studies within that huge pile of irrelevant studies. And so the way that you do that broad search is you search multiple databases. So different databases have different strengths, weaknesses, journals that they index. And so you need to be aware of what is in those databases and how to use them properly in order to do kind of that high quality search. You need to use a combination of subject terms and keywords. I'm going to get into that. I keep saying I'm going to get into it. I really will. I have several slides. And you also search the gray literature. So if I was in person or if I could see the chat better, I would ask people how familiar people are with the term gray literature. For those of you who may not have heard it before, gray literature is just material that has been published kind of in a non-traditional format. So mostly when we think of traditional publishing, we're thinking of books, we're thinking of and journal articles. Those are the main kind of two types of evidence. Gray literature is going to include things like conference proceedings, conference presentations, preprints, anything on social media. I had to search through so much social media stuff during COVID-19 when I was doing a lot of rapid reviews. Anything that is put out by the government, any kind of statistics, any reports by public health organizations, that is all considered gray literature. And depending on your topic and your question, whether you might have to include gray literature as part of your search as well. And oh yeah, I mentioned this before, you want to make sure that your search is quite current, and so it's updated before you go for publication. So the second kind of element is that it avoids potential bias. And so it does that kind of by how the search is constructed and the fact that everything that meets the search criteria is included, and then you go in and screen results. So it's not you kind of, again, picking the results that you want right from the get-go. Is transparent and reproducible. So again, this comes back to, have you shared your searches or given a link to them? Can people go in and see them? And not just for one database, but for all the databases. Could somebody go in and recreate your search exactly if they needed to? And the way you do that is you document everything. I also publish all of my searches now, so they're in an online repository so that I can see them, other people can see them, and that when I publish journal articles, I just provide the link to that now. So just to say, search strategies available here. And that your search itself is consistent with reporting guidelines. So that means, for example, I use Prisma S for reporting. So what I include when I'm writing up the methods for the final article. Oh, there it is. See, Prisma S. Okay. So searching, I have spent years developing my searching expertise. So it is not something you can kind of get a great grasp on in 30 minutes. But I wanted to, again, give you like really broad strokes. And I wanted to point you to kind of what I see as 3 of the best resources. So this one is a basic one, more basic one for my institution, but it's how to search in the health sciences. And what I really like about it is this search strategy worksheet. So you can download that. That will help walk you through everything that we're going to talk about today. You can see different kinds of searching aspects, specific skills, where to search, all of that kind of thing. And then this one here, Searching the Literature, a guide to comprehensive searching in the health sciences. That is from my colleagues at the University of Toronto. I think is probably the best guide on doing advanced searching. So I would highly recommend that one. If you prefer kind of online learning, so if what you learned today is you really want to dig into it and get better at it, is my colleagues at Queen's University, which is in Ontario, have created these online modules and walk you through kind of step by step how to do systematic review searching. So a lot of great additional resources to do further education on the topic if you wanted to. Okay, so the steps involved in a search is one, you want to use a framework to kind of take your question, your PICO question, and turn it into searchable concepts. And people definitely struggle with that one. I will show you some examples. Then you want to plan your search. So you want to outline where are you going to search, where are you going to find your gray literature. Then you want to do your draft search. So the way that it works for me is I will work with a team, a research team. They will say, this is the what I'm interested in. I will create a search for them and then I send it to them. And then we really have a back and forth, right? I work with so many teams. I am not a healthcare professional. So I don't have that content expertise. So what they can do is they can say, no, I'm not interested in that, say, specific procedure. Let's take that out. So it's kind of a conversation that we have about what to include. And what you would do is you would work with your team to figure out that draft search. And once you're the process involved in that is that you use subject terms and keywords, you combine those together, and you use what are called limits and filters. I think I refer to them later on as hedges to help narrow down your search. And then you test it. So you test your search to ensure that it's finding what you want it to find. It's working. The numbers are kind of manageable. It's not pulling in too much irrelevant result. And this can happen through discussions with the rest of your team as well. And what's also helpful is to test your search is if you have what are called seed articles. So articles that you know are on your topic, you know you want your search to find, you can test your search once it's done to make sure it finds those specific articles. So that's often a part of the process. Okay, so let's start with one, turning questions into searchable concepts. So let's go back to our PICO question from earlier. This time, in addition to PICO, I added the S because I wanted to put in a specific study type. So this is my PICO, these are my PICO concepts, but that doesn't mean that when I do a search, I'm going to search for all of these. So from this, what you would do is pull out your searchable concepts. So concept 1, children. Concept 2, cancer. Concept 3, medical cannabis. Those are going to be what you search for in the literature. You often do not search your comparator unless it is another, say, treatment or another drug. If it's just standard treatment, if it's just placebo, you just leave it out completely. You also, I see this a lot, you often do not search your outcomes either. So you don't want to say, put in nausea and vomiting. You don't want to put in pain. You don't want to put in anxiety. Where these outcomes will come into play is when you're writing up your protocol and your inclusion and exclusion criteria, is you will put that the studies, the outcomes measured have to include nausea and vomiting. They have to talk about how pain was reduced. They have to talk about how anxiety was reduced. And so when you screen your articles, you will screen them to include or exclude based on these outcomes because you'll be able to look at the full text of the article. But your search often is only about the abstract, so you don't want to include these. And then the final thing you will add to your search is a filter to narrow it down to RCTs. So again, all of this, and we're just going to focus on these 3 concepts and RCTs. Okay, so once you have your search, you want to pick out which databases you want to use. So I mentioned before, databases have different features and coverage. I've listed some of the main ones here. I looked at your institution just to kind of make sure that you had the ones that I was going to talk about. The only one I didn't see there was Embase, so I put that in the square brackets, but maybe I just missed it. Ovid Medline covers all areas of biomedicine. It is typically the first place that all searches start in. It's just kind of standard practice. You build your first search in Medline, and then you go through and adapt it for the different databases. And really, which databases you choose are going to depend on what your question is, what your topic is. So if, for example, you also touch on like anything related to allied health or nursing, you're going to want to include CINAHL. If you have anything to do with mental health, psychiatry, psychology, you want to include PsycInfo. ERIC is an education database. Yeah. I also saw, I'm pretty sure that you have access to Scopus, which is a huge multidisciplinary database. I include it in almost all of my systematic reviews now. So I would say this is a good resource to have as well. I didn't put it in here. I will just throw out this as well, because people often get confused. For a systematic review, you don't need to search PubMed and Medline. You can pick which one. They are, for most people, depending on your topic, they are basically the same content. So Ovid Medline just gives you a better interface for more advanced searching. So just pick one. I would pick Ovid Medline if you have it. You don't need to do PubMed as well. Many of us are now very worried about what is going to happen to PubMed, and as a result, Ovid Medline, based on changes in your government. So as of right now, the content has not been halted. They have not removed removed material, but it could happen in the near future. So all of us are kind of keeping a close eye on that. Okay, so you also want to take a look at gray literature. So I'm not going to talk about it. It's a whole other thing. But I wanted to give you some resources again to go to if you want. So one is a resource just on how to search the gray literature. And this is kind of a database almost of different resources for where to search for gray literature. So just be aware that it's there if you have to include it. I would say if any of you have topics that relate to public health or community health, that is the area where I see gray literature having the most value, but it can be relevant to other areas as well. Okay, so this is going to be the part that kind of takes you the longest, is how do you go about creating your actual search? So what you have to do is you have to identify subject terms and keywords for each of your concepts, and you have to have a combination of both of them. So what are subject headings? Maybe you're asking yourself that, especially if you don't spend a lot of time searching. So subject headings are a controlled vocabulary that a lot of databases use. So what they do is they standardize language. So if you think about all the different ways that people can talk about something, they're talking about the same thing, but they're using different terminology to describe it. So these subject headings, or also called controlled vocabulary, basically provide consistency. So even if you think about things like singular versus plural, right? Or British spelling versus American spelling. So how do you account for that variation in a more kind of structured and organized way? That's what subject headings allow you to do. The most commonly known one are medical subject headings, or MESH, which are again created by PubMed. And you can see, let me just put in the one I like to use the most, cellular phones. So say you were looking at cell phones, how distracting are they in high schools, for example? So let me actually put in it. Yeah, let me put in mobile phone. So what you do in this MESH database, you put in the concept that you're interested in, and it will tell you what the MESH term is. You cannot make up a MESH term. They are predetermined. So you can see I put in mobile phone. It tells me use the MESH term cell phone. If I click on that, it's going to give me a definition. This one's pretty straightforward. What is a cell phone? But sometimes there can be real confusion. I think another one, I used this one for the longest time. So I used braces when I was teaching dentistry students, because that's what I called them. Let's use that brace. But braces as a MESH term only refers to orthopedic appliances. So if you are talking about orthodontic appliances, that is a different MESH. So sometimes reading those definitions can be helpful based on what your term is. Okay, but I just wanted to go back to my cell phones. So if you click on the term, the mesh term, you get a definition, you get the year that it was introduced. So what happens is mesh are not created until there is enough literature on a topic that it deserves its own mesh. So it doesn't happen automatically. So it takes a bit of time until it appears. I'm not going to get into subheadings, but I wanted to show you this. So this single term, mesh term, it captures articles that are about all these different topics. So as opposed to you having to think about all the different ways that cell phones might be described or talked about, it captures all of these. So it just kind of makes things simpler. And what happens is that when an article comes out, it usually is given about 10 to 15 mesh terms. Mesh terms describe what an article is about, as opposed to just what words it happens to use. And mesh terms and all of these terms, they're always arranged on like a hierarchical structure that shows the relationship between the terms. And I think I mentioned many. Okay, not all databases use them. CINAHL does, PsycInfo does, obviously Medline does, Scopus doesn't. They are different from keywords, and I'll get into that. Oh, and I wanted to show you this. So they are applied at the most specific level. So what I mean by that is, I'm going to scroll down to this one. Okay, this is just an article about here in Manitoba. So you can see here, so this study took place in Manitoba, which is where I live. But it is given at the most specific level. So even though this article, the study took place broadly in Canada, because it is about Manitoba, it's given at the most specific level. So it would be like if a study was done in a particular state, it would only be given the state subject heading, not the broader United States of America. Okay, actually I do have a better, I think I had another. I'm going to do this one and then I'll go back to those other things just to kind of emphasize something. So what people wonder, why do you have to search both? There's different reasons. So sometimes articles you need to have both because you're trying to be comprehensive. So sometimes articles can have the wrong mesh. So this particular article, just a Winnipeg article for you, is about a particular area of my city, and they looked at well-being. If I scroll down and look at the mesh. So again, these are the terms that are supposed to describe this article. You can see it's been given the mesh term of Alaska Native. My province is not in Alaska, so this mesh term has been, it's the incorrect mesh term. So if I didn't also search with keywords, for example, I would have missed this article if this was, say, my topic that I was interested in. What can also happen is many articles are not given mesh terms at all. So here's another article that took place in Winnipeg. If I scroll down, there are no mesh terms at all. So if I didn't search with keywords, I would not find this article. Sometimes articles are missing important words. So I'm going to click on this one again. This is about, I'm just showing you all these bad parts about Winnipeg. Okay, but we had let's say congenital syphilis reemergence in Winnipeg, Manitoba. Nowhere in this whole abstract or in the mesh terms below, let me show you. There are no mesh terms, is the word Canada. So if I was interested in congenital syphilis outbreaks in Canada, if I didn't also search using keywords, a very broad search, I wouldn't be able to find this article. And some articles have very limited keywords. So here you can see, here's an article. It has no abstract at all. It does have mesh terms though. So that is why you have to use a combination of both. I know it seems repetitive. People don't like doing it, but it's just because of how these terms are applied. You need to have both if you want to do a proper systematic review. Okay. So the other thing to be aware of when you're constructing your search is what the difference is between explode and focus. So maybe you've seen this. So if you see the letters EXP and then your term, for example, let me click on the United States. So this is the mesh term for United States. You can see all of your states are underneath the United States. They are grouped by region. So if I was doing a search and I only wanted American results, I would need to search this term and all the terms underneath it, all of the states underneath it, and I would have to do what's called exploding. So explode searches this term and all of the terms underneath it, if you've ever seen that written. Same thing with cancer. This is neoplasms. This is the subject term. It's going to search cancer, neoplasms, and then all of the specific types of cancer underneath. So just be aware that that is what you may want to do when you're building your search. That's kind of the difference. And then you can also, I'm not going to get into this, you can do something called focusing, which narrows your search. We don't do it as much in systematic reviews, but I just put some numbers there so you can kind of see the difference. Okay, and then again, just showing you the variation in terms of concept to the various keywords that can be used to describe that concept, the mesh term that is associated with that, and then some other subject terms. So for example, if I was looking at substance-related disorders in a different database, I have to use a different subject heading, and a different database, I have to use a different subject heading. So you can see that sometimes they're really similar, adolescents versus adolescent, but there is variation. So this is why systematic reviews, partly, this is why it takes time. You have to do a good search, and that can take time to really get familiar with all of these parts. Okay. So those are subject headings. Keywords are the words that you come up with. They are free form. You make them on your own. As an author, you can put your own keywords in. It's kind of like what you would just put into Google, right? But what you need to know is that as you move from database to database, is that how that database interprets your keywords will vary. So you have to change your syntax. Again, I said this is just what databases do. You just have to kind of accept it. They're all slightly different. And I highly recommend this tool right here. So again, once you've created your kind of main search, and then you need to get it ready for other databases, if you use this tool called Search Polyglot. Oh, this was just an old search that I had. Okay. Hopefully you can see that. I'm just gonna, there. So what I've done is I've copy and pasted. This is a search I just finished. You can see it's all about different different drugs and for cardiovascular diseases and heart disease. Okay, so this is my whole long search, just to kind of give you an idea that I did in Ovid Medline. Then if I need to put it into another database, so say I needed to put it into CINAHL, if I click this, it will translate the search for me. So I don't have to worry about that. And then I can just copy and paste parts in to just streamline that process to make it a little bit easier. So you can kind of explore which databases are here. I would say the most of the big ones are here, especially if you're doing anything related to health, but it also has like the sciences as well. My caveat for that is that it does not translate your subject headings. So that part you have to figure out on your own, but anything that is a keyword, you can just copy and paste. It just makes it a lot easier. So if you didn't know about that one, definitely use that. Other things to be aware of when you're building a search is maybe you have seen this sometimes when you're reading a search, is these little symbols. So what do they mean? So the little asterisk is a symbol for truncation. And what it does is it searches for the root of a word and then all of the variations so that you don't have to type them all out. So I have put in the word exercise, and then I cut off the E and I put in my asterisk. And then the database will then search exercise, exercising, exercised, all of those variations without me having to type them all. Just be careful of where you put that asterisk. So I was working with some grad students today, and they were interested in looking at supportive kind of housing and supportive homes for people with intellectual disabilities. So they searched the word home and then asterisks because they wanted homes and home and homes and all of that. But what I told them was like, well, that if you just put HOME asterisk, that's also going to get you everything about homeless people. So you just want to be careful about where you put that little asterisk. The second one to use is what's called a wildcard. So that just tells, oh, I put it in the wrong spot. Oh no, I guess that could work too. I feel okay. So you can put it in to search when there's variations in the spelling. So actually sometimes women, I feel like it's spelled with a Y. They're right. No, the Y is here. So really this wildcard should have been where the E is, and then it would search for women or women with a Y. I don't use it a ton because it doesn't work in all databases, but it is there. This one I use a lot. It's called proximity. So it's adjacency. So what it does is it tells the system, I want to search for this word within 2 words of that word. So it can be really helpful. So if you've ever done a search and you're getting so many results, so many look irrelevant, try out this proximity to see if it can help you. You can change this number to anything. It can be a 1, it can be a 5. Standard is like 1 or 3. I don't know why. But you can see if I did women adjacent to exercise, it will search for women who exercise or exercise programs for women. So it just broadens your search, but still keeps it really relevant. The other one to be aware of is what's called phrase searching. And hopefully most of you should be familiar with this. But what it means is if you put kind of quotation marks around your search, it will, around multiple words, those words have to be beside each other. So in PubMed, if you just searched exercise programs, the word exercise could be in one sentence and the word program could be in another one. But doing it like this means it has to be together. So I say, yeah, you can definitely use this, especially in specific databases. And I've linked out here to a guide that talks you through how to use these in each database, because it varies from database to database. So this kind of guide will help show you how to adjust, as well as that search polyglot that I showed you will help too. Okay, so when you kind of have built your concepts, some things to remember, these are kind of back to the basics, especially if you haven't done any searching for a while. Anytime you use the word or, it makes your search bigger. And you use or in between similar terms. So if we go back to our PICO topic, you can see if I search cannabis or marijuana, I will get a larger kind of set of articles. So or makes your search bigger. And is what you use when you are combining your different concepts. So here I have this whole set of articles on cannabis or marijuana. On this side, I have articles that are about cancer or neoplasms, and I combine them to make it smaller. So the more concepts you include, the smaller your search will get. Okay, and so we don't have time for me to kind of go into all of this, but I wanted to show you what it would look like to build a search, a comprehensive search on our concepts. So what I did is I went and, well, this is actually a systematic review I've already done, but I've gone through and I've chosen all the subject terms related to kind of cannabis and marijuana. And then I've done the same thing for cancer. And then I've gone through and pulled out a whole big list of keywords that you can see. These are all the different ways that cannabis and cannabinoids can be described in the literature. And same thing with cancer. So I made some suggestions for where you can look if you are trying to identify subject terms and keywords to build your search. But that's kind of, this process can take a little bit of time, but that's what you're doing. You're just trying to be really comprehensive and think about all the different ways that a topic can be described in the literature. Okay, so now I'm going to show you kind of what that looks like. So I put the link to your version of Ovid Medline here, so that should hopefully work for you. I'm going to use my version of Ovid Medline. And in that link that I shared right at the beginning of class, oh wait, hold on, I'm gonna have to log in again. In that link that I shared right at the beginning of class, I copy and pasted my different concepts about cannabis and cancer. So if you wanna open them up to follow along, to kind of see what it looks like, obviously you can kind of feel free to do that. But I'm just going to kind of go through and very quickly show you what that looks like. Okay. Sorry, I have to copy and paste my stuff here. Okay. So I'm going to just bring it up, actually, just in the interest of time. But what you can do is you can kind of copy and paste just to see it. So here you can see for this is Ovid Medline. I have searched anytime it's indicated by that backward slash, that indicates that it's a subject term. So you can see cannabis, I have cannabinoids, all these variations. So these are my subject headings, lines 1 to 6. Down here are my keywords. And you can see I'm using a lot of these little asterisks. I've used phrase searching kind of here and there. And my standard when I'm searching keywords in Ovid Medline, this is what I indicate, TWKF. That can be one of your little tips. And then I've grouped them all together. So here, what this is doing is I've said I want any of these. Okay, there we go. I was just waiting for it to load. Let me scroll up to the top here. Okay, so this line right here, sorry, search line number 8, I've said to the database, I want any of these articles that were found from search lines 1 to 7. So that is my cannabis concept right there. And you can see it's not a perfect plus. There's definitely overlap between some of these, but that is a pretty exhaustive search of any articles that might relate to cannabis or medical marijuana in this particular database. And then what I've done here is I've gone through and I've put in my cancer topic. So here I have neoplasms, cancer pain, and then my keywords related to cancer. And then this is my cancer topic, cancer concept right here. And then I'm going to show you what this is in a second. This is what's called a search filter. And what it does is it narrows down just to children. So you can see these are all the articles that are about children in this database. And then I'm going to combine, I accidentally combined them twice. I've combined them here. So I've said 8 and 12 and 13. So that's 13 and then 12 and then 8, my 3 concepts. I've narrowed it down to 553. And then I've narrowed it down to randomized controlled trials and have ended up with 190 articles. So those articles are further below, and then I could go through, or actually not even go through, I would take them all out for a systematic review. You don't get to kind of pick and choose, you take them all out. So I know that that was fast, but there is a lot of resources online for how to get used to Ovid Medline if you've never used it, if you've only ever used PubMed. It has a steeper learning curve, but it is a much better resource for searching, for advanced searching. It gives you much more control over your search. PubMed does a lot of interpretation for you. So I don't like it for systematic reviews kind of at all. Oh, and then what else was I going to show here? Yeah, okay. So, yes. If when you get to the documentation part and you want to save your results, any of these Ovid databases, so that would include PsycInfo, which you guys also have, you want to click this button right here, Share Search History. And if you copy that link, you can send that to a colleague, you can put that in your documentation. That will recreate this search exactly. So it's really helpful to share and save searches. You can also copy your search history details. That will copy and paste your exact search, exactly how many articles you found. So very helpful for kind of the whole documentation process. Okay. Some other tips to help you kind of streamline your search is that what other librarians and information specialists have done is they have built search strategies for very commonly searched topics. So that's what you saw when I put that search line in for children. So as opposed to you just narrowing it down to kids, that can be a very kind of a not very great way to narrow things down. So what you do is you use these search filters. And so there are a whole slew of them. I've listed 3 different resources where you can find more, but you can see, let me go look at this one from the U Alberta. You can say search on specific geography. So if you're interested in different countries, different regions, or let's say specific health conditions. So part of your concept is say related to type 2 diabetes. Well, as opposed to you having to think about all of that, you can just go in and take a look at the search that they built, copy and paste it. You would cite it in your methods, and just to kind of help save time on your end. And there's tons on like methodology. So if you're looking for specific study types, populations, if you're doing geriatrics, pediatrics, pregnant women, refugees, there's just a lot of different of these, again, helping streamline your process. So I've listed out the main ones that you might want to refer to there. Just so that you're aware for documentation, so once you've done your search in each database, getting the results out will vary from database to database. You can always just Google like Medline export results, and someone will tell you how to do it exactly. But my tips are to always select the RIS format when you're taking references out. Always take the full reference. And it's as soon as you take it out, you want to rename the file to give it the name of your project, the database you got it from, the date you took it, and how many references you found. Again, I'm all about just documenting things from the get-go to save you time, so definitely recommend that. This link will show you actually how to export results from different databases. It walks you through step by step. And in terms of documentation, I always just tell people, just write it all down. So what I've linked to here are a sample search log. So both of these are Excel documents. You can download them right from here, use them, and they will help guide you through what you want to document to make it easier when you are about to publish about what you want to include. I also have a zip file that shows you a sample file structure that you might want to use to organize. There's just a lot of things that need to be kept track of in a systematic review. So if you just start kind of strong by having a good process up front, it'll save you so much time and energy from later on. Okay, and then these again are going to be my most highly recommended resources. I already mentioned Queen's, but these are how to do an introduction to systematic review. So kind of what I covered today. If you are about to say, write a protocol and you want even more information, this one will walk you through a protocol. And this one will walk you through searching. So what I just covered in 20 minutes, it will go in much more depth. The U of T's 2 guides as well that are very helpful. And then the University of Manitoba, this is the workshop series that we do every year. It's typically between like 5 to 7 hours where we walk people through the whole systematic review process. So in much more depth than I'm able to cover today, we go kind of through it there. Okay, so that was my just trying to get in just on time so that I made sure that I could address any questions. But I did want to share, because somebody had asked right at the beginning about backwards and forward citations so that I don't forget. I'm going to go to my version just to make it easier. So what backward and forward citation searching means is that once you have identified your articles that you're going to include in your study, is if you take those included studies and you search for them, I'm looking in Scopus. I believe you guys have access to that. Scopus is a really great database for that. So I'm just going to pick a random article from our Medline search. Okay, let me take this one, for example. I know it's not about cancer, but I'm going to take it anyways. Actually, you know, I'm going to go to a slightly older one. Let me go to, and there's a reason for that. It's just going to take a second. Okay, so I'm going to take this one. So I've copied the title, and then what I've done is I've pasted it into Scopus, and then I've hit search. So what Scopus allows you to do with any articles that you've identified, so it's a bit scrunched. Let me just scroll over a bit so you can see a bit better. Okay, so Scopus is a very big multidisciplinary database, and it has really great features for what are called backward and forward citation. So if this article you included in your systematic review, what you could do is you could put it into Scopus, And then you could see, well, who are the 10 people who cited it since it came out? So that's called forward citation. So you would quickly click on that, make sure that there was nothing in here that you hadn't already found from your search. And so you would want to just quickly skim on these. And then you would also, you could hit back and you could see the article and you could see every reference, every reference that they cited in the original article are listed here. So actually this is very valuable, even if you're not doing a systematic review. If you're doing a search on a topic and you're just having trouble finding things, you can only find 1 or 2 articles, put it into Scopus and do this backward and forward citation, because what you can, it's like a snowball. So you find one article that looks relevant, and then you find a whole bunch of other articles. Well, say that one looks helpful. Then you could say, okay, that one's been cited 19 times. Let me go look at who it originally cited. So it's really helpful, especially if you're studying in like emerging areas that don't have a lot of standardized vocabulary yet. It's just a really helpful way to find additional articles. So yeah, that's all I had covered because I wanted to make sure that I could address any questions. I'll just pull up the Mentimeter and just see if people had any questions in that they put here. They didn't. So yeah, does anyone have, I can stop sharing and maybe see a little bit better. I know I had to cover things really fast, but please let me know if you have any questions.
It's a lot to digest, right?
Yeah. That's why you have all those slides to look back to.
Any questions, comments at this point? Okay, I think they're saving all the wonderful questions for later, so you'll be bombarded with the emails now.
Yeah.
But this is definitely one of the most comprehensive sessions I've ever attended. Thank you so much. You packed so much into it. As you know, I've been involved with numbers of systematic reviews. I think this was a great resource, everything you shared. And I must say, you've been extremely generous in terms of sharing your resources, all the links, even the templates that you have developed. And I'm very, very sure that our students, colleagues will really benefit from that. So thank you so much. Really appreciate it. So feel free.
Thanks, everybody. Yeah, good luck. Oh, sorry, go ahead.
All I was going to say, feel free to email her. And if you have any comment on this workshop, this session, you can email me if you want to put confidential, send it to some other colleagues, they'll give it to me, okay? Thank you so much. Anybody on the online, any questions, comments, raise your hand. All right, well, thank you. All right, appreciate it. Have a wonderful evening. And
Thanks, bye, everybody.
Yes, thank you so much. Appreciate it. Yes, thank you.